The other morning, my alarm went off, and like most of us, the first thing I did was grab my phone, start scrolling through Facebook. Probably a habit I need to try to break, but it's part of my morning routine at this point. In between the cute baby photos and the silly memes, I was hit with a post from an old coworker. It said, "I'm tired of admitting babies that would otherwise be healthy, but their mothers decided to do drugs while pregnant. I don't care what drugs you do or how much sex you have until they coincide. Either use protection or use your brain. Hashtag send those MFers to jail." At first I thought, you go girl, right? Preach it. But then the more and more I thought about my position as a mental health provider, I had some differing thoughts. In my eyes, addiction is a mental illness. While it can be reckless and damaging to the baby, would we take the baby away from a parent who had diabetes and decided not to manage it during pregnancy? The ethical dilemma around addiction in pregnancy and the policies around this issue are ones that require a great deal of reform and consideration. The Substance and Mental Health Administration has estimated that around 400,000 infants each year are born with exposure to alcohol and drugs in utero, sometimes both. This is the equivalent to one infant being born every 25 minutes with some sort of drug or alcohol that had affected them. Currently, the regulations on how drug use in pregnancy is handled is on a state-by-state basis. Almost half the states aim to punish rather than aid in treating mothers who use drugs during pregnancy, and in some states, this also includes alcohol use. Most states either punish or treat. It's very rare to find a state that does both. In 2014, Tennessee actually became the first state to view the use of narcotics while pregnant as a form of assault. And there are other states out there who are finding loopholes in laws that were once created to protect children from drug distribution and production, and they're actually now able to use that against mothers who have used drugs themselves while pregnant. A number of states require healthcare professionals to report and test for prenatal drug exposure, which can be used in evidence in child welfare proceedings, and this mandatory reporting is required by states in order to receive certain funds. While this may seem like a positive and proactive measure to protect children, it is also preventing many women from seeking the prenatal care out of fear of being incarcerated or separated from their children. This can result in issues with both the baby in utero and postnatally, as well as possible complications for the mother during her pregnancy. Statistically, babies born to addicted mothers are more likely to be born premature or small for their gestational age. Many are diagnosed with NAS, or neonatal abstinence syndrome. Basically, this is where the baby experiences withdrawal symptoms from the drugs that the mother used during pregnancy. If the child were born in a state that believed drug use or assault or child abuse, it could lead to significantly less maternal bonding time once delivered. According to the World Health Organization, there's a strong clinical significance between close contact between newborn babies and their mothers after delivery. This is even more important for babies that are born premature or low birth weight, which a lot of these babies are when there's drugs used during pregnancy. With laws in existence that would place these infants into the care of Child Protective Services, it could definitely play a long-term negative impact on the development of the child. According to the American Academy of Pediatrics, punitive measures taken towards pregnant women, such as criminal prosecution and incarceration, have no proven benefits to infant health. However, providing treatment and preventative measures for the mother does. Viewing addiction and drug use during pregnancy with an eye for punishment is not the answer. Policies and funding need to be put into place to help with pregnancy-specific substance abuse treatment and also prevention. So what needs to be done? Simply put, more state funding for drug and alcohol treatment that's specific for pregnant women. There's been a staggering increase in the number of pregnant women admitted to substance abuse treatment for opioid disorder. In 1992, 2% of pregnant women were admitted for treatment. Wow, 28% were in 2012. However, there are few programs that are actually geared for the specific population. So they could be in treatment with someone who's not pregnant, male, elderly, something that is totally out of their population. and not get the proper support they need. So while there are more women getting treatment, their treatment is not specific for pregnancy. Only 19 states have state-funded treatment programs specifically designed for pregnant women, and only 15% of the current treatment centers across the country have specific services with substance use disorders, and they're most likely in urban settings. It's also important to point out that there are a few states that do prioritize pregnant women when accepting them into these funded programs. However, there definitely needs to be a stronger push to put those women on the top of the list. In February 2015, the Prenatal Drug Use and Newborn Health Report was released. It helped to highlight the gaps that existed in services for pregnant women struggling with addiction. As a result, the Protecting Our Infants Act was established under President Obama. While this does not help to create more programs for mothers, it does require the Department of Health to review the programs that do exist and help to address gaps and develop guidelines for treatment, as well as provide resources for states to start programs. While this is a start, we need to work to develop programs that aim to support those who are pregnant or have delivered a baby with a coexisting history of addiction.